So what is the impact of patient no-shows in healthcare? Well, in this video, I'm gonna share with you the unfortunate details of how no-shows impact the patient and the healthcare system. Hey guys, I'm Dr. Ryan Corte, and this is Ryan Reflects. On this channel, I share with you self-improvement content so you can thrive personally and professionally. If you're new here, hit that subscribe button. Also, throughout any point in the video, check out the notes and links in the description below. If a patient doesn't show up for a scheduled appointment, it's bad for both the patient and the practice. First, let's look at how no-shows impact patients. Continuity of care is discontinued. Patients no-show to appointments. They don't get the care that they need. Unfortunately, preventative care and screenings aren't delivered in a timely manner. Acute illnesses can evolve into chronic conditions. For patients that are on medications, they're less likely to be monitored effectively. More expensive emergency care later on. So as these no-shows pile up, and let's just say the patient had a acute condition, they went and saw the doctor, things got a little bit better with the initial treatment, but there was a follow-up that was missed, and then they reached back out and the patient missed the next follow-up. All of a sudden it turns into a chronic condition, which can lead to more catastrophic issues and more of a burden on the healthcare system. Preventative and early onset care, well, it's better for the patient and it's better for the healthcare system. When patients miss appointments, this burden, not only placed on them and their health, is also factored into the cost of healthcare for everyone. Fortunately, I created a video on how to decrease patient no-shows in your practice that I'll link to above. Every missed appointment could have been filled by another patient. You ever called a doctor's office or a specialist and their next available appointment is 3-4 months out? Yep, I've done it. And guess what? Those doctors, those specialists have no-shows that happen every single day. And that impacts the ability for people to get in quicker, to have their condition, to have their questions or have their concerns resolved accordingly. Hey, if you're getting value out of this video, hit that like button. Next, let's look at how no-shows impact the healthcare system. Lost revenue. No-shows are expensive. We're talking $150 billion annually in the US healthcare system. On average, each physician loses about $200 for an unused slot, and this adds up over time and is a huge issue when you're trying to operate a healthcare practice. Staffing imbalances. Most healthcare practices staff for a full schedule, particularly if they're an established practice. No-shows and last-minute cancellations increase the amount of, well, could be unproductive or idle time. Unless your staff is super disciplined, the last thing you want is your staff to have a number of no-shows and they're trying to kill time by maybe scrolling through social media, right? On the clock. Increased cost of care to see patients. Every office has fixed costs, staff, rent, equipment upkeep, technology. And if you're thinking about your practice, you probably have a number of line items that are fixed costs on top of that. Running some quick math, every missed appointment increases your cost to provide care to the patients that do show up. Again, because that fixed cost divided by a decreasing number of patients, that cost adds up quickly over time. What do you feel is the biggest impact of appointment no-shows in healthcare? Let me know in the comments below and stay tuned for my next video where we can reflect and grow stronger together.